मुस्तकीम तू वीडियो बना.
Let's start from the easiest microspecimen. Take it. You. What is it?
Sorry.
फोटो कैसे खींचेंगे यहाँ से?
What organization?
It's foot.
Foot, yes.
Gangrene of foot.
Gangrene of the foot. Yes. And what is the cause of the gangrene? Ischemia due to what? Diabetes mellitus as itself cannot lead to gangrene. But what else?
Tuberculosis.
No. Ischemia due to what? Which is typical for diabetes mellitus. Over. Of arteria poplite, arteria femoralis, arteria tibialis dorsalis. So atherosclerosis of arteries of the leg. But in diabetes mellitus, the incidence of severe atherosclerosis is higher than in absence of diabetes mellitus. Understand?
Okay, sir.
But what is the origin of black color?
Ferrous sulfide.
Iron sulfate. It forms under the influence of what?
Reaction with oxygen.
Microbes and oxygen of the surrounding. Yes, okay. Show me what it is. This is the kidney. The kidney. Do you see depression of its surface?
Can you just rotate?
Depression. Do you see?
Yes. Please.
Show to them. Do you see depression? What is the depression? Rough depression, yes? It is. Initially, it was infarction of the kidney. And now, what do we see? Formation of what?
Scars.
Of scar. Yes, of scar. So, who can give the full name of this process? Initially it was infarction, then it is scar. What is it? Post-infarction nephrosclerosis, yes. What was the cause of death? How do you think?
Renal failure.
No. Could the patient die from renal failure?
No, infraction.
It is. What is infarction? Local. Necrosis. Local death. But the surrounding tissue is normal and it compensates the loss of function of necrotic area. So the patient did not die from renal failure. He died because of any other causes. Compensation develops. Compensation. Understand? In contrast to, I don't see.
पूरे बताइए पूरे है मैंने की नहीं आवे छोड़ दो
Что-то я не вижу.
नाम बोल के आ जाएंगे नाम भी याद होने चाहिए जो बता रहा है याद नहीं ऐसे लगा फर्स्ट टाइम सुन रहे
I don't see the microspecimen. In contrast, take it. In contrast to this case, what about the size of kidney? Of the kidney? Large? Large? No, very, very small kidney. What about the surface of the kidney? Microgranulation. Do you see it?
Yes, sir.
This is the kidney in arterial hypertension or arteriolosclerotic nephrosclerosis. In this case, the patient died from renal failure because there was no ability to compensate because both kidneys were affected seriously. In this case, look again. No. Where is the previous? In this case, take it. We see sclerosis, the focal sclerosis only, yes? As a result of infarction as the focal necrosis. But here we see diffuse ischemia of the kidney as a result of arterial hypertension. What develops in arterial hypertension? What about arteries and arterioles? They are very narrow because of constriction or sclerosis. In this case, there is no reason
सर वो क्या चीज़
there is no chance to compensate
दोनों ठीक है पिछली
because all parts of both kidneys are affected. Understand? And in this case, the patient died from renal failure. In this case, because of some other cause.
patient
Yes? Okay. Give me. No. Give me. Don't make it. Is it clear?
सब क्लियर ही है सर
Take this microspecimen and that one and that one. Look and compare. These are ulcers in the stomach, and this is in duodenum. Stomach here, and this is duodenum. Do you see any difference between these pictures and similarity? Maybe similarity. You see?
स्टमक के राइट साइड वो
Let's start from this microspecimen. He is tired. Help him. Come on, take it.
इन duodenum है
ये जो
Let's start from. This is what? Very deep and big ulcer. Yes.
सर ये
Chronic,
ulcer
peptic ulcer of the stomach, and no, the other. Duodenum. Do you see ulceration?
यस
Yes, also big and deep ulcer. So this is ulcerative disease, or chronic peptic ulcer of the stomach or duodenum. Yeah. And what about this microspecimen? This is the open stomach. What do you see?
अल्सर
These are also ulcers. But what is their number?
एक्यूट पेप्टिक अल्सर
Number. Their number.
मल्टीपल
They are multiple. Yes. And what about their form?
स्मॉल
Form.
रेगुलर
Irregular. In this, in peptic ulcer of the stomach, they look more or less round. Yes?
Yes.
More or less round. So what about these ulcers? Are they acute or
Acute.
chronic? Acute.
No,
Peptic
chronic.
ulcer. Acute peptic ulcer of the stomach. Is it the original disease or complication of some other disease?
complication
Complication of some other diseases. And what are these diseases which are complicated by acute peptic ulcers?
हाइपरसेक्रेशन
What is the mechanism of these ulcers? Tissue hypoxia and microcirculation disturbances. So it is necessary to think about those diseases which are accompanied by severe disturbances of microcirculation and tissue hypoxia. What are these diseases? Severe.
Tissue hypoxia is due to the narrowing of the blood vessel.
atherosklerosis or arterial hypertension
Hypertension is a chronic process. If you speak about arterial hypertension, it is necessary to speak about what condition of arterial hypertension.
crisis
Yes, hypertensive crisis. Yes, first. Okay, because crisis what? Spasm. Sudden spasm of many arterioles and small arteries, including the stomach, arteries and the arterioles of the stomach, and ischemia, local ischemia, and then autodigestion, formation of multiple ulcers, and other diseases, severe diseases, with microcirculation disturbances and tissue hypoxia. What about the lungs?
lungs failure
Pulmonary
emphysema
No, emphysema, it is a chronic process. Acute, sudden acute. Severe pneumonia. Yes, severe confluent pneumonias like Krupus pneumonia. Yes, what else? About the heart, what can you say about the heart? Huh?
bronchitis
Myocarditis. Theoretically, yes, it may be. But usually it is what? Switch off your light. No? Myocardial infarction. And what about the brain?
brain function
Yes, insult, hemorrhagic, ischemic insult, and after 3, 5, 6 days, acute peptic ulcers develop in patients. And what about the color of the contents of the stomach? It looks like what? Coffee ground. Vomiting like a coffee ground. Yes. What is the color of the bottom of these ulcers?
Black.
Due to what pigment? Hydrochloride,
Hematite.
hydrochloride, hematite, dirty brown color, and the color of vomiting mass is like coffee grounds. Okay. And where is the chronic urticosis? Okay. What about complications and causes of death? Possible complications of such very big and deep ulcers. What may happen with this? What could happen? Bleeding, yes, what else? After perforation with peritonitis. Okay.
अरे अल्सर है chronic
Take
comedy कर रहा है
it. What do we see here? We see two blood vessels.
yes sir
One of them is artery, one of them is vein. And all these veins are blocked with thrombotic masses. One thrombus is red, one thrombus is white. It is necessary to point the vein and the artery. Red in artery and pale in the vein. Yes?
Yes.
No, on the contrary. Red in the vein and white in the artery. Why? Because in the artery the blood flow is very, very intensive, and hemoglobin is swept away from erythrocytes and they become pale. But in vein, the blood flow is very slow and hemoglobin remains in erythrocytes. Understand?
Yes, sir.
But what about the disturbances of hemocirculation as a result of blockage of the artery? Femoral artery, arteria femoralis. So, arteria femoral and vena femoralis. No, so
Gangrene.
gangrene, yes, severe ischemia of the leg with possible gangrene if nothing to do. Understand? Okay. Так. Take it. This is the pancreas. Pancreatic gland. Yes, what is it? Do you see multiple white spots? Huh? These white spots are nothing else but what? Take it. Take it. Necrosis. As a result of what? Autodigestion. With what? With trypsin. The enzyme which is produced by the pancreas itself. Yes?
okay sir
How do you name this process? Acute pancreonecrosis. Yes, pancreonecrosis. Initially it was disturbance of hemocirculation in the pancreas. And then, as a result of it, destruction of some pancreatic cells with the release of trypsin, and trypsin began to digest the surrounding tissue with formation of necrotic foci of white color. Is it clear?
Yes.
sir
Huh? Okay. Так.
सोच लो सर
Take it.
कल तक इमेज भी नहीं है सर
This is the thyroid gland. How does it look? What about its size?
increase
Yes, what is it? Goiter. Yes. What morphological types of goiter do you know? No. Morphologic, not etiologic, morphologic. Diffuse and what? Diffuse and nodular. What is it?
it's
Nodular goiter. Do you see these nodes?
yes sir
What is the risk of these nodes? They may give what? Can they give? No. No. They are now. These are benign nodes, but with time some of them may undergo malignant transformation with carcinoma of the prostate gland. But the risk is very low, about 1-2%. But nevertheless, it is the real situation. How can we diagnose these nodes?
By palpation.
Palpation, yes, or
Ultrasonography.
ultrasonography. Yes. Very difficult for whom? For men or women? Women are predisposed for different endocrine disorders.
वो खत्म कर दिया है
सब लिखो शायद देख ले
15 ही लिखा है तो हो गया 20 28 हुए 28 हुए
हाँ हमने तो डबल हो गया ना
अलग अलग सेपरेट सेपरेट का बता रहा हूँ
स्टार्टिंग में डबल उसको डबल डबल करेगा
ना एग्जाम में एक ही
Ah, here it is. Только это не тромбоэмболизм. It is not thromboembolism. Take it. It is not the thromboembolism. It is what? This is the enlarged prostate gland and the urinary bladder. Where is the prostate gland and urinary bladder?
सब ब्लैडर तो नीचे है
Huh?
ऊपर ये प्रोस्टेट ग्लैंड है.
Yes, the prostate gland is at the bottom of the glass. Yes? And what can I say about its size? So what is it? Benign, benign prostatic hyperplasia. And what did it do? The prostate gland, so big, what did it do?
It will
Compressed.
compress the
What?
urinary bladder.
No, no. The urethra. The urethra. Urethral portion of the prostatic portion of the urethra was compressed by the enlarged prostatic gland. And what developed after all?
urinary
Urinary
bladder
bladder.
size increase.
Increase size of urinary bladder and this led to the kidney failure.
The urinary bladder was forced to contract with high power to push out the urine. And what developed with
It
it?
will rupture and all the toxic substance will go in the body.
Come on, come on, come on.
Hypertrophy.
Hypertrophy of the wall of the urinary bladder. Yes, one, but with time, with progression of the process here, compression
Wall of किसका?
progressed also, and then retention of the urine developed initially in the urinary bladder, then in the
pelvic of the
urethras, and then in kidneys, with formation of what? Hydronephrosis. Take it, take it. These are two kidneys. What do you see here?
हाइड्रोनेफ्रोनी वही है ना? हाँ.
What do you see? These are two kidneys.
ये से हाइड्रोनेफ्रोनी दूसरी है. दूसरी देखा?
Do you see
Yes, sir.
dilated calyces?
Yes.
As a result of what? Accumulation of the urine, and
Urine
the urine begins to compress the renal parenchyma from inside with dilation of calyces. And what about the parenchyma? How does it look? Well pronounced or very weak? Huh?
Very weak pronoun.
Yes, so what is it? Atrophy. As a result of prolonged compression from inside. What was the cause of death of the patient?
Kidney failure. Oh, kidney failure.
Renal failure. So is this disease mortal or immortal?
Mortal.
Yes. In absence of treatment, it leads to
Death.
hydronephrosis with renal
Failure.
failure. Okay. Так. Ага. Okay. Take this microspecimen. This is the kidney with the same process. What do you see? Dilated calyces, yes?
Yes.
But it is only one kidney. It is a unilateral process. What is the cause of hydronephrosis also?
Yes.
What do you see in the pelvis? In the pelvis, what do you see in the pelvis? Give this glass to them. What do you see in the pelvis? No. What object is it? Stone. It is a stone. What did it do, the stone? It blocked, yes, the ostium of the urethra. And with the same how do you name this disease? The name.
Uremia.
Kidney stone.
Oh, kidney stone, it is not the name of the disease. What is stone in Greek? Litos, come on, no.
Urolithiasis?
Nephros, kidney, yes? Nephrolithiasis with hydronephrosis. If the process is unilateral, the opposite kidney takes upon itself the function. Will renal failure develop? No. If the process is bilateral, then death will be. Understand? Okay, take this microspecimen with caution. Take it. This is the liver. What do you see here? What is the design of the gut section? It looks like they got the design of nutmeg cut
Yes.
section. So what is it?
Nutmeg liver.
What is nutmeg? What does it mean? Nutmeg liver. Chronic venous congestion of the liver. In what? In what patients does this process develop? Right or
Right.
right heart failure. Yes, as a result of what? When does the right heart failure develop? Pneumo, very good. How do you name this heart? In pneumosclerosis, in what else? In emphysema of the lung. What about the right heart then? In emphysema and pneumosclerosis? Huh? Take it. This is the heart and the right ventricle. The thickness of the right ventricle wall is about, in normal condition, 2 or 3 millimeters, and in this case,
Increase.
about 1 centimeter. So what is it? Hypertrophy of the right ventricle as a result of diseases, chronic diseases of the lungs, and these diseases are emphysema and pneumosclerosis, and we name this heart as what? Chronic pulmonary heart. And in the compensation of this disease, of this chronic pulmonary heart, then venous congestion develops where? In the venous segment of the greater secret. Yes, with involvement of the liver, of the kidneys, spleen. And what about the appearance of the patient with venous congestion in the greater secret? Cyanosis. Acro or diffuse? Acrocyanosis. What else about legs? Edema of the legs. About peritoneal cavity? What is ascites? Accumulation of edematous fluid. And what is the edematous fluid? What is the origin of this fluid? Blood plasma. Yes. And what about the pleural cavities? Hydrothorax. About pericardial sac? Pericardium. Yes. Okay. Very good. Very good. Tak. And now this microspecimen and that one. Take it. These are two forms of pneumonia. What types of pneumonia do you know? Bronchopneumonia and Krupus pneumonia. Yes. Where is bronchopneumonia? Where is Krupus pneumonia? Krupus pneumonia with the blue.
Yeah.
With the blue color. This is Krupus pneumonia. This is confluent bronchopneumonia. What do we see? What do you see in the Krupus pneumonia?
Rough surface.
No. Pale, grayish color here and here also. If not to take into consideration these black spots, these spots are due to smoking. What can we say about the picture? Is it more for monomorphic or polymorphic? In this case, monomorphic, but in this case, patchy colored. Do you see? Multicolored. Confluent bronchopneumonia. What else do we see here? Do you see the membrane which is detached from the lung? Here.
Yes.
What is it? Pleura. No. With fibrous deposit. What is it? Fibrous pleuritis is highly typical for Krupus pneumonia. In bronchopneumonia it also may develop, but the most typical pleuritis is for Krupus pneumonia. What pneumonia is more severe? Why? Because the process involves the whole lobe within few hours.
Yes.
In this case, the lobe is affected within days and weeks. And there is time for compensation. In this case, no time. Understand? Okay.
खत्म हो गया? पता नहीं। अरे यार, बत्तीस के ऊपर गए इतना समझ लो
एक दो और
एक तो बार बार इंटरवेल करवा हो गया बुढ़े छोड़ दे
No. Take this microscope.
अरे सर वहाँ पे कहाँ गया फोटो तो भाई
Look. There are three objects in this glass. The first is
इधर आएगा तब ले लीजिए
the vena femoralis, which contains the thrombus. Where is the thrombus in the vena femoralis? Do you see? Yes, this is the thrombus. The second object is the thrombus itself, which teared off from the. Oi. Ну сейчас я подойду. Which teared off from the primary location. What is it?
थ्रोम्बस
Thrombo M. And finally, the thrombus stopped where? In the pulmonary artery. What is pulmonary thromboembolism of pulmonary artery? The patients die within few seconds as a result of what? If pulmonary arteries are blocked with thrombi, no blood flows